Good evening, everyone. I am Varsha Srivastava from Bladder Wellness Team. I hope you all are keeping safe. Please vaccinate yourself and wear a mask when in a public place. Today, we are here to talk about urinary incontinence or overactive bladder. Overactive bladder is a frequent or sudden urge to pass urine that may be difficult to control. The condition is common and distressing and may have a huge impact in the quality of life. So, in this week, let's unite to raise awareness about incontinence related issues and its impact in the life of people living with it. To throw more light on the subject and guide us on what is right for diagnosis and treatment of urinary incontinence, today we have with us Dr. Kshitij Bishnoi, sir. It gives me an immense pleasure to introduce Dr. Kshitij Bishnoi, sir, to you all. Dr. Kshitij Bishnoi is a senior consultant urologist and urocancer and kidney transplant surgeon from Hisar, Haryana. Sir is a qualified surgeon from PGI Chandigarh and has also done MS from AIMS Delhi. Sir has a rich experience in the field of urology and carries out the treatment with utmost precision and efficiency, ensuring that the patient's health is in safe hands. Sir, it's a pleasure to have you in our show. We welcome you.
Thanks a lot, Varsha.
Sir, there are many things that we would like to know about urinary incontinence. So, first, we will start with its meaning. What is urinary incontinence?
Well, incontinence is basically spontaneous passage of urine, which is involuntary. That is without the patient's desire to pass a urine. So, any accidental leakage of urine is termed as incontinence.
Okay. And sir, what are its types? If we just elaborated, what are the different types of urinary incontinence?
Well, it is of basically three types. First is urge incontinence. Second is overflow incontinence. And third is mixed kind of incontinence, which has both the symptoms of urgency as well as overflow.
Okay. So urge, mix, and even we have stress incontinence. Okay.
Yeah. Oh, yes. It's a part of urge incontinence only. And when sometimes you have spontaneous leakage of urine predominantly in female patients who are post-menopausal, who can have passage of urine with raised intra-abdominal pressure, like on coughing, sneezing, speaking in loud voices, can also lead to incontinence. This is a part of the stress incontinence.
Okay. So, sir, does this urinary incontinence is a age-related problem or it can happen to anyone, anytime?
Well, it is predominantly seen in elderly people, as with time, our pelvic floor muscles, which are an important part of preserving a person's continence, they become weak. And like in females with repeated childbirths and normal vaginal deliveries, there is a lot of stretching of these muscles happen, and which leads to decrease in the tone of these muscles, and subsequently people will develop some amount of incontinence. The other is sometimes it is a primarily bladder problem also, like in overactive bladders, or where we see urge incontinence. So in those patients, what happens that your bladder becomes overactive and you have a strong desire to pass urine, and sometimes when you try to rush to the washroom, you might have some amount of leakage, which we term as urge incontinence. The other form is also overflow incontinence. In that problem, basically patient don't have a desire to pass urine, and bladder becomes full, and when it is overflowing, then the patient is having spontaneous dribbling of urine. So that is predominantly seen in elderly diabetic male patients and in some patients with neurological problems.
Okay. And sir, what are the causes behind it? Why does it happen?
Well, it is most of the time it is because of the fault in the normal pelvic floor musculature. So it mostly seen in postmenopausal females who are having because of loss of female hormones, decrease in the female hormones in the postmenopausal woman. the tone of muscle decreases, and the whole of the pelvic organs, they subsequently develop what we term as postmenopausal changes, and because of that, there is a loss of tone, and it causes the leakage of urine. So, and the other is predominantly the patient can have neurological causes. In male patients, it can be because of prostate also. In other people, it can be because of upper motor neurons lesions, like in Parkinsonism. Patient generally have repeated frequency along with urgency and urge incontinence. So it is a spectrum of diseases which causes this kind of problems.
Okay, so there are different type of causes that may lead to urinary incontinence, and that shouldn't be ignored at all. Okay, and so many people think that this urinary incontinence is a normal problem that can happen to anyone. So it is a self-cure. People think like that. So is it really self-cured, or we'll have to consult the urologist as and when we are finding any kind of symptoms?
Well, it is basically because of social stigma, predominantly, like women try to ignore these sort of problems because they don't feel comfortable to talk to their relatives and even doctors regarding this. So because of that, they also have a generally, and in old age also, like what there is a tradition, like one of my patients told me that it is a tradition that my mother used to have had this, and she also told that her grandmother also used to have it, so it is a normal part of normal aging. No, it is not a part of normal aging. It is an abnormality in a person's body, and it is curable. It is curable with medications, with endoscopic treatments, and along with that, open sling surgeries and different kind of surgical modalities. So the first thing is you should identify that it is a problem, and you should consult a proper urologist for it, so that he can identify which kind of incontinence you are having. And all these three kind of incontinence have different pathways for treatment. So all depends upon your proper identification of symptoms, and subsequent to that, proper treatment, diagnosis, and a proper management for the problem.
Okay. So, sir, now talking about the treatment, what is the best possible treatment available to cure urinary incontinence?
Well, the first thing, as I said, that it all depends upon the proper diagnosis of the problem. Like, for example, if you are having a urge incontinence, like you are having repeated urgency to pass urine, and there is a strong urge, and you are not able to control your urine, and you are having increased frequency, like you are passing urine, suppose 12 to 15 times per day. All these sort of problems generally can be cured by simple medications, which are once a day or twice a day dosage. And after that, most of the people, around 60% of the population, gets treated by simple oral medications only. And when one person fails oral medical therapy, then subsequent endoscopic and other sort of management is also there for that.
Okay. So, sir, whenever we take any kind of medication for any type of a problem, so there are some of the other side effects related with the medication. So, is it the same case with the medication that we take for urinary incontinence?
Yeah, basically there are some sort of side effects which can happen, but nowadays we are having more and more specific drugs for it. Like in bladders, there is a muscarinic receptors, which are cholinergic receptors, and now we are having a drugs which specifically act on bladder only, and these don't have that sort of systemic side effects which the first generation drugs used to have. Now the newer generation of drugs are having lesser and lesser side effects, and they are more and more specific for the bladder problem. So the side effect profile have improved of various drugs, and now we are able to treat it with very less side effects from the medications.
Okay. So yes, the side effects are there. This is for all our viewers. Whenever you'll take the medication, you'll find some of the side effects, but there's nothing to worry about it because the cure or the solution to those side effects is also there. So there's nothing to worry. Okay. And sir, how long do we have to take the medication to get the proper result?
Well, generally, there are few drugs which act within a period of 48 to 72 hours, and you would start experiencing initial improvement in symptoms within 2 or 3 days. Generally, the effect of the drug stabilizes over a period of 1 to 2 weeks, and what I generally practice is I give drugs for 2 to 3 weeks, and once patient gets stabilized on the medications, then I try to taper it off, and yeah, so we can switch over to just a single pill after a period of 3 to 4 weeks.
Okay, okay. So yes, it will take a very less time actually to get the result, but yes, you have to be patient enough. Okay. And sir, why do we have to opt for the surgery? Why we'll have to take the surgery as an option? Does the medication doesn't work? That is why?
No, actually, it depends upon the severity of the symptoms. See,
Okay.
drugs have a particular role and they can help you out to a certain extent only. Because once what happens that in overactive bladder, if you are, say, if you are having upper tract symptoms, that is when your kidneys are being getting affected, or you are not improving with drugs so much that your what we can say is the frequency is within the normal range. Say, suppose you are having a frequency of half an hour prior to taking drugs, and after that you after drugs you are having a frequency of an hour, but both these are uh, not going well with the quality of life. So one person should have a frequency of around 4 to 6 hours. So between the two urinary voids. So sometimes then in these sort of patients, we have to go ahead with surgery. Surgery is by endoscopic means also, which is a cutlass surgery. We can go in with a endoscope, that is a cystoscope, and we can inject some drugs in your bladder so that your bladder gets relaxed and you tend to have improvement in the symptoms. And sometimes you have to go for some extensive surgeries also, like augmentation, cystoplasty, and all those sort of things when your kidneys are getting affected. So it all depends upon the severity of symptoms which you are experiencing. In most of the patients, we can treat the patients with the help of oral medications only. Like I have said earlier also, 60% of the patients gets treated with oral medications only.
Okay. So, in few situations, we'll have to go for the surgery. We'll have to adopt the surgical options. Okay. And sir, how long does it take for the patient to get back to his normal life once the surgery is done?
Well, for endoscopic surgery, generally only 24 to 48 hours of admission is required, and you are up and about on second or third day, and you can get along with your routine day-to-day activities within a period of say 5 to 7 days. And in more extensive surgeries, you tend to take a bit longer to recover also, like in augmentations and all those sort of scenarios. These are extensive surgeries, so it takes a while for you to get up and get going.
Okay, okay. And is the surgery painful? Because many of the patient they have this fear that if they'll go for the surgery, what if it is very painful? Will they be able to take it?
No, ma'am. Actually, the endoscopic surgeries and the sling surgeries, basically, which are for stress urinary incontinence, these are most of the time these are done as a daycare or a single day admission procedures, and you are discharged in on the next day only. And in endoscopic surgeries, there is generally no cut in your body, and it is done through your urethra only. uh, and the open sling surgeries, these are generally these are very fine surgeries, and there is only hardly a single stitch which is there in your body, and slings are placed and you are up and about on the next day morning itself.
Okay, so yes, the science has really advanced much, and we don't have to worry about it because, as sir has just now mentioned, that it won't be painful for you, and you won't be able to find even any kind of cut. So that is also a very good thing actually for all the patient. There is nothing to worry about it when it comes to the surgical option. Okay, and so once the surgery is done, can the patient have this problem once again? Can urinary incontinence reoccur?
Well, in most of the cases, like suppose in urgency and overactive bladder, uh, in on endoscopic surgery, like when we inject a botulinum toxin in patient's bladder, so that has a duration of say about 6 to 9 months. So because Botox, the effect of Botox uh, tapers off within a period of 6 to 9 months. Uh, as far as sling surgeries are uh, there for stress urinary incontinence, generally these patients do well, and there is only around 10% of the patients in whom a recurrence can occur, and where you have to go in again and redo sling surgery for that.
Okay, okay. So yes, the chances are there, but it will take a long time actually. But the patient also have to be really, really careful. If you will not be careful enough, then again the chances are there for the problem to reoccur. So, sir, apart from the medication or going for the surgical option, as you have mentioned earlier, what kind of behavioral changes or lifestyle modification can we bring in our lives that will really help us to get rid of this problem completely?
Well, the first thing is good exercise. Basically, Kegel exercises. These help in maintaining the pelvic floor muscles tone and
Hmm.
a good
Okay.
healthy pelvic floor. So Kegel exercises help a lot. The other thing which you can incorporate in your life is you don't have to overdo do on fluids. So excessive drinking of liquids, which is generally for which is said in a layman's term that if you are having a kidney problem, just drink water. That will solve any problem. No, it's not like that in a bladder problem. You have to restrict your fluids, restrict your caffeine or a tea intake. So your coffee and tea intake should go down because these are all diuretics and you will have increased frequency because of those also.
Hmm.
The other thing which you can incorporate, you should avoid drinking alcohol, and you should avoid tobacco also. So because all these things would eventually contribute in a bad health and would precipitate the problem for you.
Okay, so we'll have to be really careful, as sir has mentioned that even the alcohol consumption should be avoided. And sir, as you mentioned, the caffeine intake. So the person or the patient should completely stop drinking coffee, or he can still have 1 or 2 cups of coffee in a day.
Yes, 1 or 2 cup of coffee is all right, but the schedule of your drink should be like that, that it is more in a daytime sort of period. Like you have to avoid drinking coffee late in the evening, so that because if you are consuming it late in the evening, then you would have a increased nighttime frequency of the urine. So you have to restrict it, and you can have a 1 or 2 cup of coffee or a tea. That would be sufficient, but you don't have to overdo. The main thing is you don't have to overdo it.
So definitely, once like we take anything in excess amount, it will definitely be really harmful for our health. So you can have, as sir has mentioned, 1 or 2 cups coffee, but avoid having coffee in the evening or night time. So, sir, in our country, there are more tea lovers, or the people they eat more spicy food. So, what kind of precautions they need to take? Can they drink tea? Is it really normal and it won't affect their health?
No, all these basically both coffee and tea, they are a stimulant for diuresis. Diuresis is increased production of urine. So both are having a diuretic effect on your body. So uh, when you are taking it in excess of amount, so your urinary production increases, and when your urine production increases, your symptoms would increase. So by doing this kind of lifestyle modification, you are basically controlling your symptoms along with that. As far as spicy food is concerned, it generally don't.
There is a slight network issue. Okay, so this is for all our viewers. There's a slight network issue, but there's nothing to worry. We'll get back to Dr. Kshitij Bishnoi sir in a while. Okay, meanwhile, I hope all the viewers have noted all the important points. Okay, sir, can you hear me?
Yeah, I am able to hear you.
Yes, sir. So we were discussing about the spicy food intake.
Yeah, so spicy food as such would not cause any increase or decrease in your bladder symptoms, but having a spicy food, you tend to drink a lot of water along with it. So again, that would increase your bladder symptoms. So the key is your fluid intake. So if you can restrict your fluid intake, your symptoms would improve.
That is a very important point actually that we got to know, that yes, when we eat spicy food, we tend to drink more water. So that definitely will lead to urinary incontinence once we drink more water than what is needed. Okay, so that point should be kept in mind by all the viewers. Okay, so sir, now taking few questions that we have got from the viewer side. So the first one is from Sonia. She's asking, sir, what are the examples of self-assessment test for urinary incontinence?
Well, for these are basically for stress incontinence.
Okay. Okay, so again, there is a network issue. There is nothing to worry about it. I hope that sir has mentioned about the spicy food intake and the caffeine consumption. Please keep all these important points in your mind, because because in our country we eat more spicy food and we drink more tea or coffee, and that will directly or indirectly lead to urinary incontinence. So if you are the one, please just cut down the consumption of tea or coffee, and please don't take spicy food. Sir. Sir, it is mute actually.
Yeah, are you able to hear me now?
Yes, sir. Yes, sir.
So basically what happens that these self-assessment tests are basically for stress incontinence, and these are basically to assess your pelvic floor. And what happens that when you say changing your position, like in squatting and in sitting position, on coughing, on sneezing, if you are having some amount of incontinence, that signifies that you are having a stress urinary incontinence. As far as urge incontinence is there, it is basically experienced by the patient itself only. So when he or she is having a strong urge to pass urine, and if he is not able to control it uh, before reaching washroom, and he leaks urine, so that itself is a definition for urge incontinence.
Okay. So yes, there are different kinds of self-assessment test available, and you can check that whether you are having urinary incontinence or not through that. Okay. So sir, next question is from Phoebe. She's asking, sir, can emotional stress cause overactive bladder?
No. Stress urinary incontinence is basically related to your intra-abdominal pressure. So whenever your intra-abdominal pressure increases, so it increases basically in coughing and in sneezing, if you are shouting and speaking in very loud voice. So all these increases intra-abdominal pressure. So that causes a stress on your bladder and causes incontinence. Well, emotional stress basically causes anxiety. So anxiety as such can precipitate uh, with some urinary behavioral abnormalities. So voiding, which we say that voiding problems. So that can precipitate with the emotional stress, but no, stress incontinence would not precipitate because of emotional stress.
Okay, okay. So, sir, taking the next question, and it is from Dolly Saxena. She's asking, sir, may I know what drinks are good for incontinence?
Drinks.
Yes.
Well, basically, the drinks cranberry is one thing which is a urinary and kind of antiseptic. So cranberry decreases your growth of flora in your bladder, and it prevents urinary tract infections. So cranberry juices are advised in patients who are having recurrent UTI along with a overactive bladder or a urge incontinence. So cranberry juices can help in these things. Citrus fruits, citrus juices also help in this. So they changes the pH of the your urine, and all these things help in preserving and preventing urinary tract infections.
Okay. So these are the few drinks or the fluid items that you can take that will definitely help you. So, sir, there are patient like there are diabetic patient and there are patient who have sugar who are obese. Are these patients more prone to have urinary incontinence?
Yes, obesity causes decrease in your muscle bulk as well as tone. So obese female or male mm, tend to have a defective pelvic floors more, and they tend to experience these symptoms more. Diabetes as such has a three components. Basically, it can cause a neuropathy, it can cause a cystopathy, and it can precipitate recurrent urinary tract infections. All these will cause more symptoms of stress or a urge incontinence. Like in diabetic cystopathy, your bladder sensation decreases and you tend to preserve in later stages as a overflow incontinence. And diabetic patients also are more prone to have recurrent UTIs, and that can also precipitate your concomitant incontinence, whether it is stress or an urge incontinence.
Okay, okay. So yes, diabetic patient, the patient who have sugar and who are obese, yes, you are more prone to be caught by urinary incontinence. So you'll have to be really careful about it. Okay. So sir, next question is from Namisha Gupta. She's asking, what are the other complications if incontinence is not treated for long?
Well, incontinence, if it is not treated properly, then you would tend to have more of
Sorry,
UTIs.
sir. Sorry to disturb you, sir. Your visual is gone actually.
Uh,
Yes. Can you click once again on the video? Yes. Okay.
yes.
Yes, sir,
So
please.
basically what happens that uh, sorry,
So
what
what
was
will happen if we will
yeah,
not?
complications.
Yes.
Yeah, so complications are basically it is more of a social problem. Second thing, it can precipitate urinary tract infections. Third thing, if it is overactive bladder is associated with back pressure changes in your kidneys, and if it is having a neurogenic component along with it, and it is not a simple overactivity of the bladder. So what happens that when you are having a neurogenic component along with it, your kidneys can damage. So basically, the proper diagnosis is to be made, like what kind of urinary incontinence you are having, because overactivity, all these problems would precipitate with same symptoms. That is a lower urinary tract symptom complex. You would have frequency, you would have urgency, you would have nocturia, and all these have a similar symptoms, but there are three different causes along with it, and there is a lot of spectrum of diseases which can be associated with simple incontinence. So you first have to make a proper diagnosis, and based on that we can go ahead with it. So it can be a simple incontinence, and it can cause complications which can lead to your kidney failures also. So there is a wide spectrum of problems which can be associated with it, and proper diagnosis is to be made to treat them.
Okay. Okay. So yes, we cannot take the chance of ignoring it because it will be really injurious to our health if we will leave it for a long run. Okay. And sir, the pregnancy and during pregnancy, the women they feel that they have this urinary incontinence, some signs or symptoms. So can they treat it during the period of their pregnancy?
Ma'am, generally in pregnant females, it is more of a pressure because of the pressure of the womb. So the when baby grows in second and third trimester, then most of the time these symptoms happen in the later stages of the pregnancy, and generally it doesn't require any treatment, and these generally vanishes off when baby gets delivered, and afterwards we can teach females to do proper Kegel exercises, which would restore the tone of their muscles, and most of the times these symptoms vanishes with it. And if you are having a small amount of incontinence, which is generally most of the times which is seen, and which can be treated with proper voiding, uh, voiding diarrhea or timed voiding, which we say that you can have a you can void at specific interval of time so that your bladder doesn't distend too much, which can cause the pressure symptoms and eventually incontinence.
Okay, so pregnancy is a very important and a sensitive phase, so you'll have to be really careful with that. As Sir has mentioned, Kegel exercise can be done under the guidance of the urologist, so it is better to consult the urologist during that particular period because that's a very sensitive period. Okay, and Sir, can we take help of yoga and meditation as well for as a supportive measure when we have urinary incontinence?
Yes, yoga do help in this because it would calm your senses, and it decreases the anxiety part, which is often associated with it, with these problems. And along with yoga, it also has yoga various asanas which are there. These also restores the normal muscle strength of the body, and these do help in treating incontinence. And along with that, if some of the neurological patients are there, then these would also benefit in those sort of patients also.
Okay, so yoga and meditation can be taken as a supportive measure under the guidance of a urologist, as in when he is telling you, advising you to take the help of yoga and meditation, then you can definitely take it. That will really help you. Any which way, it is a very good habit, so it will definitely help you. Okay, and sir, does urinary incontinence leads to UTI?
Yes, it can happen because when your clothes are soiled and all these sort of things happen, so there is a chances of ascending infection is there, that bacteria can travel from urethra to the bladder and can precipitate an active urinary tract infection.
Okay. So we'll have to maintain hygiene as well because we are having a problem related to urinary. So we'll have to be careful and else it will lead to any kind of infection in future. That should also be considered. Okay. And sir, children are also prone to this particular disease or they are safe from it?
Well, children tend to experience more of overactive bladder, and along with that, they can have a overactive urge incontinence. Uh, so basically, these are treated with medications only, and you just have to rule out any neurological cause which can be associated with these children, like in meningomyelocele, and sometimes there is tethered cord is there. So all these things need to be identified, and these are generally treated with oral drugs only.
Okay. So even the children can have the symptoms of overactive bladder, and the real cause is must get to know what is the main cause behind it. So if you are finding your child that he is showing any kind of symptoms related to OAB, please consult the urologist. Okay. And sir, when we are treating the urinary incontinence, as you have mentioned in the beginning itself, that it happens to mainly elderly patient and they are already physically not that active, and as urge continence incontinence leads to a sudden urge and they'll have to rush towards the washroom, so it may lead to some accident. So what kind of precautions they can take meanwhile?
Well, see, most of these accident happens in the washroom itself. So you just need to make sure that you have a proper uh, anti-slip mats are there in your washroom, and you can also make sure that if you're not that active and you cannot go to washroom, then you should have a arrangement which is made at your bedside only, so that you can you can avoid in a pot or something like that, so that your visit to the washroom can be decreased. And an accompanying person should be alarmed whenever you're having a overflow incontinence or some sort of severe problems are associated. And the first thing is you should consult a doctor at the earliest, because if you are having some problem like that, you need to identify it and get treated, rather than having a frequent washroom visits for it.
Definitely. The elderly patients need to be really, really, really careful because, yes, there are chances for some mishaps. So you will have to take proper precautions, and please keep on consulting to a urologist so you will get proper guidance as and when it is needed. And sir, as we have discussed in the beginning itself, that urinary incontinence is a social stigma. It really hampers the emotional and mental level of the patient because they feel really low, their confidence gets really low, and they starts avoiding to go to any kind of a public places or meet new people, as they may have a sudden urge to pass urine. What kind of advice is needed to them so that they can get rid of this problem?
Well, the first thing is there are lifestyle modifications which we have already discussed. Like you can cut short on your fluids, you can have your time voiding, you can do exercises which would help you, and you consult a doctor for it. And if you are still experiencing these sort of problems, then now there are different adult diapers and other accessories are made available, which you can use, and you can avoid having a socially imperceptible thing experience. So basically, because of that, we can do things like.
Definitely. So there is nothing to worry about it, as we have discussed earlier, that yes, this is a problem, but the solution is also there. So there's nothing to worry about or feel low about. If you are having any kind of symptoms, it's good to get the treatment as soon as possible. So the treatment will not take much long, and it will be definitely successful, and it will be painless. So there is a good chance for you to get rid of this problem. So thank you so much, sir. It was a very, very informative and valuable session for all our viewers. We have got many important points. So once again, thank you for taking out time and coming live and telling all the important points to us.
Thank you. Thanks.
And thank you to all our viewers for being so patient and asking all the questions related to urinary incontinence. I hope you have taken all the important points in your mind. So we'll see you all soon in the next session. Meanwhile, you can follow us on our FB page. We come by the name of Bladder Wellness, and you can also follow us on YouTube, Twitter, and Instagram by the same name, that is Bladder Wellness. This is your host, Varsha Srivastava, signing off. Take care, everyone. Keep smiling, stay safe, and stay healthy. Thank you so much, sir, once again.
Okay.